Hey there, welcome back to the channel. Oliver's musical genius in search of the perfect jam. This is the channel where I practice for at least 10 minutes on every single video as I progress towards 10,000 hours of public practicing. This video is brought to you by GetYouSomeProductions.com, my music production company and podcast. This video is also brought to you by GetYouSomeGuitar.com, my guitar lesson website. Links in the description for both if you want to learn how to play guitar like me. If you want to hear cool interviews and things, GetYouSomeProductions.com. If you want to learn guitar techniques, learn how to play guitar the way I play guitar, GetYouSomeGuitar.com. So today is a weekend day. I'm actually just working all day, doing stuff, and I'm taking little breaks here. And I have the Casey Means Surgeon General appointment hearing or nomination hearing because I'm interested in that stuff. So while I'm watching it, I'm going to noodle. While I'm watching it and listening to it, I'm going to noodle on guitar and get some practice in, mostly, probably Pat Martino inspired linear expression style licks, maybe some what? Maybe some scale, bebop scale, arpeggio practice too.
It's amazing. It's produced miracles. If we have an acute issue, absolutely you want to be an American to get that fixed. But 90% of healthcare costs are now going to chronic diseases. And frankly, having practiced, I've seen thousands of patients, worked in this system for almost a decade in clinical medicine, it's not the focus of what we as doctors are incentivized to spend our time on. It's not what's reimbursed, and this is a problem. Medical education doesn't focus on these modifiable root causes of diseases. The science is showing us through amazing emerging work in systems biology and network biology that the physiologic causes of the vast majority of diseases that are taking American lives and torturing and shortening our lives, even in our children, are connected by shared physiology and shared root causes. We need to upgrade the paradigm of the American healthcare system to educate and treat in that way. It is by far the most efficient way to treat, of course, because if we're addressing shared root causes, we're going to be able to stop the whack-a-mole medicine that's not working for us and that is so costly. And so my passion is to help work with the AMA, work with medical schools, work with Democrats, Republicans, all sorts of agencies across the government to ensure that we really move the needle on shifting the American healthcare system towards root causes. I know we can do it. There's political will. It's what Americans want. Even the medical schools are on board, but we need a vision to get there.
Thank you. Senator Murray.
Thank you, Mr. Chairman. Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life. And you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits, and in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, who have obesity. No, it's not general. I'm very careful with my words, and when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
people use
to women.
Birth controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk for a side effect
left and I have other
to
questions.
know.
Let me move on.
If a woman died from a stroke or a blood clot because they did not have a thorough conversation.
Thank you for your answer. You made that clear. Let me go to another question. Tracy Beth Hogue, she's an anti-vaccine skeptic. She was elevated by the Trump administration to serve as the top drug regulator at FDA. She made comments last week casting doubt on the safety of RSV vaccines for baby. As you sure know, RSV can be deadly even for healthy full-term infants. Do you believe that Dr. Hogue is wrong to question the safety of RSV vaccines?
I have not read that article or seen that quote. I would need to know what she said before I commented on that.
Well, you do know that RSV is the leading cause of hospitalization for infants.
I do. I have a 17-week-old, and I'm very aware of that.
You hear her statement as Surgeon General. Would you contradict it?
I certainly have absolutely no issue having very frank conversations with anyone in the administration if I believe that their statements are misguided in some way or not fully informed. That's not a conversation I would have publicly first. I would have a private and direct conversation with anyone in the administration if I felt that patients were at risk because of...
All right, and I also want to ask you about maternal health. Mental health conditions are the leading cause of maternal death in the U.S., including suicide and overdose deaths. In her comments last week, Dr. Hogue, same woman, also expressed concern about the safety of the antidepressants during pregnancy. Specifically, she called out SSRIs, the most commonly prescribed type. Do you believe that SSRIs are dangerous for pregnant women?
I don't want to be a broken record here, but I do believe that every medication has risks and benefits, and you need to have a nuanced conversation with your doctor before starting a medication. That is, I think, the most responsible position for any doctor to share.
Well, strong evidence has shown that SSRIs are safe in pregnancy. Most do not increase the risk of birth defects.
Certainly.
But untreated depression in pregnancy puts women at risk.
And I agree with you, but I still think a patient, I don't think it's responsible to make a blanket statement for all Americans.
Okay, well, if confirmed as Surgeon General, it will be your job to give accurate and up-to-date health information to the American people. I assume you will take that responsibility seriously.
I absolutely do, and I also believe that the American people are looking for a more nuanced conversation about health, and I believe that will help restore trust in public health.
Thank you.
Coach Tuberville.
Thank you, Mr. Chairman. Dr. Means, thanks for being here. Congratulations on expanding your family. And I know it's an exciting time for you. I also want to thank Assistant Secretary of Health, Dr. Christine, for being here. Thank you for your service. Dr. Means, I've listened to you and your brother, Callie, and I know he's here today on... I don't know how many tens and tens of podcasts I've listened to. I learned a whole lot because I grew up in the health business. I was a coach, 35 years. It's all about nutrition. So the question I want to ask you is, how do we get around this? I talk to people in the healthcare business, and in the medical field, when we train our doctors, we don't teach anything about nutrition. Everything's about a priority. And those priorities are fine, but we need to teach our doctors and nurses about nutrition, about what to put in their body. This epidemic we have going on chronic disease, as we've all talked about, is out of control and getting worse. So how do you prioritize that?
Thank you so much, Coach. And I really, really enjoyed getting to know you throughout this process. Thank you. This is so key, what you're talking about. Reforming medical education to focus on root causes. And one of the key root cause modifiable factors of chronic disease is nutrition, as we all know. There has been incredible momentum already in the administration towards making this possible, starting with the Dietary Guidelines for America, which came out about a month ago. This is the first time we've had a full-throated denunciation of ultra-processed food, and I think this is historic. It's historic when the federal government says that out loud. What that is going to do is impact medical education. It's going to impact procurement regulations for billions of meals served and paid for by federal dollars every year. We're going to see real food, more real food, less ultra-processed food going into the National School Lunch Program, prisons, hospitals, and other federally funded organizations. This, I think, it's a point that gets lost a little bit, that by just changing the dietary guidelines, it is going to trickle down into billions and billions of healthier meals for Americans. So I think that's step one. I think secondarily, we've got Dr. Marty Makary, an absolute hero, who is approaching the GRAS loophole, the generally recognized as safe loophole through the FDA. So this is a program where companies have essentially been self-reporting the safety of the ingredients that they're putting in their foods with very, very little oversight, which has led to literally thousands of chemicals in our food system that we don't know what they are or what they're doing to our body. By addressing this loophole and starting to have much more scrutiny about what's going into our food, this is going to trickle down to affect medical education, affect culture, affect what companies are putting in the food. The zeitgeist is going to shift about a lot of this because we're going to start to have transparency about what is even in our food system. Additional things are happening that are just incredible around food. There was just $700 million put forward towards regenerative agriculture. So we're going to have more investment in research and studying of soil health, water quality, nutrient density of food, and how that's affecting our health. That's going to trickle into medical education. There's a whole person health initiative at the NIH that's being put forward by Dr. Jay Bhattacharya, who's doing an incredible job. That's going to study the systems biology perspective of the body, not isolated silos, but the whole body health. And when we look at the body as a system like that, nutrition has to play into it. So this is just 4 or 5 of some of the stones that are being moved right now that all will lead to nutrition being a bigger part of our healthcare system. I think where I can help on that is elevating the work that's being done, having conversations, again, across the whole medical community to help us in a really positive and unifying way move towards a more root cause approach to health.
You think that will be a hard item to push in our medical schools about nutrition?
I've had conversations with a number of deans of medical schools who are very, very passionate about this issue. They want to change. It feels hard.